All right, guys, we are live. Let me share this link out to my group. If you don't know who I am, my name is Tony Maritato. I'm a licensed physical therapist, and I've been treating patients following total knee replacement surgery for a very long time. I don't even want to say how many years. But hey, I am here to answer your questions. If nobody has any questions to post live, I will jump into my support group on Facebook and I'll just start answering questions that I see there. But feel free, remember, this is not medical advice. This is for educational purposes only. I've had the great fortune of being a clinical instructor for a long time. So if a student, physical therapist asks me a question about knee replacement, the same information I give that student is the information I can provide you guys. So while you guys are coming on live, I'm going to take a look. You can't see my screen, but I'm inside my total knee replacement support group for kind people. Feel free to join. It's a free community, 14,000 members. So one of my members here said 9 weeks post-op, right total knee replacement. I have 102 degrees of flexion. My doctor is threatening me with a manipulation under anesthesia. What are your thoughts? What are your experiences? So that's awesome. That's a great question. One of my favorites. I think that individuals have blown, the fear of MUA, manipulation under anesthesia, way out of proportion. Obviously, nobody wants to have a second procedure. I would do what I could do to avoid going under anesthesia and having to go back in for surgery and things like that. But truthfully, I think that individuals have been so fearful of the MUA that they're avoiding it for so long, when most of the people that I've seen in my clinic who have had an MUA, they either do better or they do no worse. I've been fortunate. I've never seen a negative outcome. The worst I've seen is the patient's sore for a day or two and they're just not improving. I've had patients that have had multiple MUAs. So if you're sitting at 9 weeks and you're at 102 degrees of flexion, it really is a situation that you make the decision. If you know that you've done everything you can do, if you know that your therapist is doing all the right stuff, I would go ahead and do what your surgeon recommends, what your surgeon thinks is best for you, because like I said, the MUA just helps accelerate the healing process. If you are restricted by scar tissue, the MUA will help. If you're restricted by something else, now this is where it gets a little complicated. I know patients that are experiencing pinching in the back of the knee. That's why they're limited in flexion. I know patients that are experiencing pain associated with tendonitis, tendinopathy. They're experiencing pain due to quadriceps or calf pain, muscle pain around the knee joint. These are different situations. When I am a physical therapist treating an individual and I'm bending the person's knee, if I'm finding restriction at 100 degrees or 90 degrees or 80 degrees, my objective as a therapist is try to figure out what is causing that restriction. And I've shared this example before. If it's truly just scar tissue, when I try to bend my wrist, there's connective tissue restriction. There's the joint capsule, the ligaments. It's not painful. It just won't go anymore. I've got a patient right now with a knee replacement that happened a long time ago. They can't get past about 92 to 95 degrees of flexion, but there's no pain. They just can't bend the knee. That is a situation where the connective tissue is restricted, maybe scar tissue formed before this patient ever came to me. But if it's painful near the end range of motion, there's a lot of other things that could be causing your restriction. Now, when you go under anesthesia, you're going to be unconscious. So the surgeon is going to get a better sense for your range of motion and what the movement is like. But I would just tell you, trust in your surgeon. If you don't trust your surgeon, find another surgeon that you can trust, because it really needs to be a decision built in confidence. You need to feel good about having it. All right, Lisa's here, Rachel's here. Thank you guys for joining. So Lisa said, I had a total knee replacement 2.5 weeks ago. I hope you're doing well. I know you got more comments here. I'll read them. Rachel said, it's been since 2021, knee replacement surgery. Now I'm struggling with my hips. Yeah, it's a common situation. What would you recommend for my hips? First, so 2021 is 2024 now. First thing is I'd get back into therapy. I'd find a physical therapist who's going to do a comprehensive evaluation. It's not unreasonable. We have to determine, is the hip pain associated with arthritic changes in the joint? And I'll tell you, typically when somebody has arthritic changes in the joint that would justify a total hip replacement, their most common complaint is groin pain. They have a sharp pain in the groin, right in the crease where the leg meets the pelvis. But if the pain is more on the outside, if it's associated with hip bursitis, if it's more on the backside by the back pocket, it's probably more muscular rather than arthritic changes in the joint. A good physical therapist will help you with some soft tissue, with some strengthening, maybe take a look at how you're moving. Your first priority is to better understand what's causing the hip pain. And an X-ray will give you some information, but it won't give you all the information. An MRI, some information, but not all the information. So Lisa said, went to physical therapy 3 times. Now I'm badly bruised, crying for hours. It's so painful. I hate to hear that. I'm sorry. I know different therapists have different philosophies on treatment. Different surgeons have different philosophies. I can't say that I've never caused somebody to feel worse after a physical therapy session, but I would say that's not the norm. That's not what you should expect. And so Lisa canceled her appointments for tomorrow, waiting to see the doctor on Tuesday. I'll tell you, it's really hard for the doctor to know what, happened in therapy. But I mean, in my Facebook group, we talk about this a lot. If you're just not feeling confident that the therapist is doing what needs to be done, or the therapist is doing too much, find a different therapist. Find a different therapist in the same clinic. Find a different therapist at a different clinic. We are not all made the same. Even within my own clinic, there's 3 of us that work together. I love the other people that I work with, but I do things very different than they do things. Some patients do better with me. Other patients do better with them. You have to have that level of trust. And once that gets violated, it's kind of hard to get it back. So Val is here. Val had an MUA, one of my knees, and it helped a lot. That's awesome. Thank you for sharing that. I know there are bad stories out there following an MUA, but there are a lot more good stories. I've seen them. I've talked to those patients. I understand. And I think once they've gotten over that, they realize that it probably is going to be a helpful procedure. MJ, hello, had total knee replacement 2 years ago. I'm still in pain. So let's talk about pain, because pain is a really common situation. Let me read the rest of this. Actually, I can bring it right here. 2 years ago, still in pain. Is there anything I can do? Walk regularly, do my strengthening exercises every day. So let's talk about pain for a second. I am not an expert in pain. I will tell you, my understanding and perspective on pain has changed dramatically since I first became a physical therapist, and even prior to that, when I was a personal trainer and strength coach. We learn new lessons about pain all the time. But one thing we do feel pretty confident about: pain is an experience. Pain is very context specific. If I'm scared, if I'm sleep deprived, if I'm angry or frustrated or anxious or any of those things, the perception of pain will be higher. There is no doubt. I don't think anybody would disagree with that. But from a mechanical perspective, there's a lot of things that can contribute to the pain experience. So oftentimes, and you probably experienced this, your doctor will do an X-ray, your surgeon will look at the X-ray, and they'll say everything is fine. They'll say everything is normal, but it's not. It hurts. It's swollen. It's hot. It's red. You see all the signs of inflammation. But what happens here is we have a breakdown in the communication. You're the patient with the knee replacement. You're feeling all of these sensations. The surgeon is just looking at a picture of the hardware. So from the surgeon's perspective, the hardware looks great. Everything's intact. The bone's in place. The implants are in place. Nothing is loose. There is no problem. The surgeon did their job, but that doesn't mean that you're pain-free. And so whether it's the vascular system, the nervous system, the skin, the integumentary system, There's so many elements and components to the whole leg that can be contributing to the pain experience that you have. Um, it's really hard to find somebody who can understand that, who can take the time to work with you through this. And what I can say, the best thing that I can offer is you work to assemble your team. Maybe you see a physical therapist. Maybe that physical therapist just pushes you over the edge, makes you feel worse. Okay. You go to a different provider. There are occupational therapists that do an amazing job for patients following a knee replacement. Occupational therapy is covered by Medicare insurance and most other third-party plans. Very few people think of seeing an occupational therapist, but I think it'd be a great option for you to consider. Um, I would just tell you, look beyond the knee replacement for what's causing your pain, because it's probably going to be something other than the hardware. And if it's not the hardware, the surgeon is pretty much done. They're not going to be involved. Let's see, a couple other comments here. Had both knees replaced in the last 10 months. Val, you're a trooper. That's a lot. Knee replacement done 6 months apart. Hardest thing I've ever done, but so much better now. Better than pre-op. Got my life back. That's amazing. I love hearing those stories. You know, in my support group, in my private physical therapy practice, we tend to focus on the challenging cases, the patients that aren't doing as well as they want to do, they should have done. We lose sight and we don't do a good job celebrating the cases like yours, where you did it, you got through it, and you're better than you were. That's amazing. I want to hear more of those stories. So Maximus, I love that name. I wanted to name one of my kids Maximus. Post-op 6 months, full range of motion, but getting 0 degrees of extension only when pushing the knee down, no pain associated with it. That is the perfect example. So you're not getting full extension unless you're actively pushing on it, but it's not painful. You probably feel it pulling, but it's not a sharp piercing pain. To me, that is tightness in the connective tissue. And then it said, walking with a limp. I do have arthrofibrosis. Yeah, that's okay though, because that can always be improved. How do you improve that? Long duration, low intensity, sustained positioning. One of my favorites, and there's a video on the channel. I prop my heel, maybe on an ottoman. I cross my non-surgical leg over the surgical leg so that there's a little bit of weight pushing down. It's a very comfortable, tolerable position, but then I would spend 15 or 20 minutes in that position. Long duration, low intensity, end-to-end range of motion will stimulate the body to start to lay down the fibers that will lengthen the connective tissue. It's almost like building a callus. You know, it's summer. I'm here in Ohio. We planted zucchini and we planted tomatoes. I did a lot of raking and digging. If I do too much too fast, I get a blister. The blister is painful. It's disgusting. But if I do it slow, if I expose my skin on my hand, slow and controlled repeatedly over time, I will develop a callus, a thickening and a lengthening of the tissue. That's what you're trying to do inside the joint. Totally achievable. Just be patient. Just stay persistent. So what else do we have here? Great channel, by the way. Thank you so much. I appreciate that. Ooh, I like this name. Happiness in Nature. Hey, Tony, total knee replacement, 26th of April, and immobilized for 6 weeks as I had a bone graft and in the tibial head. Oh, that's tough. After I'm going to PT since the last month and a half, reached more than 90 degrees, but I just lost it. Okay. So I've seen patients in the past who have had a tibial fracture, tibial plateau issues, couple other procedures that are kind of similar to what you're dealing with. You know, you're a special case, right? You're not a typical run-of-the-mill total knee replacement. The immobilization is going to have an impact. But again, that doesn't mean it's never going to get better and never going to improve. And so when I'm working with a patient like you, who's been through what you've been through, I try really hard to avoid focusing on range of motion numbers. You know, you mentioned 90 degrees. Okay. But what does that really mean? Like, nobody had knee surgery to achieve a measurement on a goniometer. People had knee surgery to be able to function better, to run and jump and play and squat and crawl and do all these other things. So it's like, okay, let's put the range of motion on the shelf for just a minute. What are the things that I really want to improve? What parts of my life do I really want back? You mentioned nature in your YouTube handle. Like, do I want to get outside and walk and do those things in nature? Let's focus on that. Even if I don't have the range of motion that I would like to have, how can I do the things that I want to do with the range of motion that I already have? And we focus on the positives, we celebrate the achievements, and we also cut ourselves some slack. So we know that, hey, it's okay. I know I'm doing what I need to do. I know when I'm broken and beat down, I just take a break. That's okay. Hey, we got 30 viewers on here. Thanks, guys. I appreciate it. I've got about 5 more minutes. Let me see what else we've got. Kevin, 4 years past a total knee replacement, still feels hot and sore. Is that normal? Great question. Lots of clicking. Had a lot of therapy. Okay, so let's talk about this. What would be causing the heat and the soreness? When they do the total knee replacement, and I'm not sure if you watched the video of the actual surgery or not, but basically they cut through the superficial skin, they retract, they cut around the kneecap, they cut into the knee joint. There's a lot of vessels that are disrupted with that. The lymphatic system is a huge, important system in our body that very, very few people talk about except lymphedema therapists. And so when the lymphatic system is disrupted, it is totally possible that you would continue after healing to have the redness, the heat, the soreness, the moderate swelling. It might not swell up like a balloon, but it's going to be more swollen than the other knee. All of that is common. I'm not going to say it's normal, but it is common. And so if we're not understanding the lymphatic system and we're not working or talking to somebody who understands it, we might not be doing the right things. So I would recommend, it's been long enough. If you can do a little research in your community, there's probably an OT or a PT that specializes in the lymphatic system. They can show you some strategies, whether it be compression wraps, whether it be a cooling system, or just manual therapy techniques that you can use for yourself to reduce some of those symptoms. Because right now you're kind of stuck in this chronic inflammatory state. You know, when you hear somebody say inflammation, there are signs associated with inflammation. Signs of inflammation are pain, swelling, redness, heat. All of those, that's not inflammation. Those are signs of inflammation. Inflammation is a chemical process. So if you can have a mechanical change, compression, massage, any of those things, temperature changes, if you can have a beneficial mechanical change on the knee that you can control yourself, you can reduce the signs of inflammation and support the immune system to help finish the healing process. That went way too deep. All right. Happiness, you're back. Range of motion in just 5 days. Knee is on fire. Strong pain around the patellar tendon. Calf muscle so tight and hard, so painful. X-ray of the knee is fine. Surgeon asked me to rest. Yeah. So I would kind of do the same thing. I would say, all right, let's scale it back a little bit. Doesn't mean you have to be in bed for the next 48 hours, but it means, hey, let's do a little less. If you've seen my videos about the rolling pin massage, whenever somebody talks about a hard calf or thigh muscle, I would spend 2 or 3 minutes doing a little rolling pin massage, preferably going, from distal to proximal, meaning I'm pulling up toward the hip joint as opposed to up and down, because what I'm trying to do is move some of that fluid out of the system back to be processed through the kidneys. And then, pain at the patellar tendon. I mean, that's classic. That is somebody who is overworking a connective tissue that's too weak. You had the surgery, it's been a while now, but still that patellar tendon and some of those connective tissues are they can't recover quick enough for the activity levels that you want. So we either have to speed up the recovery or reduce some of the workload. And reducing the workload might mean Instead of walking 60 minutes, we walk 30 minutes. And if 30 minutes is still too much, we go to 15. But then we support the immune system with making sure we sleep as well as we can, we eat as well as we can, we stay hydrated. I'm a food guy. I will always promote food over vitamins or pharmaceuticals, but sometimes you just need a little help. And so I would never recommend or prescribe any particular vitamin, but I would say, look, for the next 10 days, I'm going to try to eat the most whole, nutritious food that I can find, whatever you believe to be nutritious food. Everybody's different. And focus on my rest, focus on my recovery. So, all right, guys, I am out of time. I need to get back. I've got some patients coming into the clinic a little bit later this evening. As I said before, I will continue to try to do more of these live streams. I love your questions. Thank you so much for bringing them. I hope every time I come on live, you guys are here. I'll catch you on the next one. Thanks again.